Dr. Lily Fraser.
Tēnā koe.
The new COVID-19 vaccines, what do I need to know? Talk to me how you've seen Māori. Do we tend to gravitate towards vaccinations? Is it something that we do?
Why would Māori have a reason not to get vaccinated?
What would your advice be to those whānau who are vulnerable, who are mistrustful of vaccinations?
As a health provider, you know, one of our big mahi is to make sure that we're actually having a kōrero out there and putting it out there around what we know, how the vaccines work, if people have fears or conspiracies or other awanga about the vaccines, that we actually have a really direct kōrero around where that information has come from and try and dispel some of those myths that are out there. Our whole world has changed because of tēnei ngangara. We are so lucky to live in Aotearoa, and I think we've all felt that in the last year that, you know, he whenua pai tēnei, he whenua haumaru, te nuinga o te wā ko te kaupapa nui ko te tangata. A vaccine is going to bring another way of life for us, that we can start getting back to ngā āhuatanga o mua. People have their own personal reasons why they choose not to vaccinate. I think it's a good thing that in our country it is not compulsory to vaccinate. You know, I encourage people to vaccinate, but I think kai a koe toa ke mana motu hake, kai a koe te tikanga ki te whiriwhiri, ka pēhea tō tinana.
I worry about the speed at which the vaccine was made.
What should give me the confidence that this vaccine's going to be okay for me and my family?
Is it safe?
Yeah, I mean, I think that's definitely been a big kōrero. So usually it takes many years to develop a vaccine, and this has been done in a year. A lot of this knowledge is already known, you know, so even though the mRNA ones are completely new, they had been working on them for the last almost 2 decades. You know, so the technology was there. There was a big boost of funding. Where each step might have taken longer, usually they overlapped them all. So you still got all the information that you needed in a much shorter time frame. So no steps have been kind of shortcutted to be able to get it out quickly. Also in Aotearoa, we have MedSafe who assess every new drug and every new vaccine that comes into the country and make sure it meets our own safety criteria.
Is there a place for tikanga in the rollout of the vaccine?
Yeah, I definitely believe there is. At the moment, I don't think there's any formal process in place, but it may be that some whare hauora want to do some kind of karakia when the first vaccine arrives in the clinic. It might be that when you're getting ready for your own immunisation, maybe that karakia plays a role in that. But I think, you know, a big part of tikanga is actually the way that we manaaki tangata and kōrero kanohi ki te kanohi. And so I think that the way that we conduct ourselves when we are giving the immunisation is really important as well.
In 1918, the Spanish flu, when it came, like, it decimated whole communities. And I think for like a lot of the whānau who live in rural settings, especially where I'm from up north, they were really scared that this could turn out the same.
Is there a plan of how those communities will be supported?
I think there's going to be lots of approaches. So there will be your usual GP practice to get it. There will be drop-in centres set in the community. And there will also be mobile units. If you know of a rōpū or a whānau who might be isolated, who may not have engagement with a health centre, you know, put your hand up for those mobile clinics to come out to you.
Oh, that's good. That's good to know.
I have many vulnerable whānau who have trust issues with leadership, who are, you know, always looking for some kind of trusted site. Kehia.
Definitely in the last year with everything that's happened, I think that the COVID-19 site is still my first go-to because it really has the up-to-date information around our approach in Aotearoa to COVID-19. And definitely the immunisation information is there with links to other sites that have already been reviewed in their way.
Thank you very much for your time, I appreciate it.
E pari ana ngā tai o mihi kia koe rā, i te tākuta e tākuta Lily. I tō whakatūwhera mai i a koe me o mātauranga kia mātau. Te hunga e pīkoko nei.
I'll go away from here just being a lot more knowledgeable now, so thank you.
Orira tēnei kai mahi rā, kia koe.
Kia ora.